Hi guys, this is Jay Goswiko with EMT Paramedic on Facebook and a couple of nurses and doctors that I work with. This is all about IVs and let's just jump in. First thing I want you to do is apply your tourniquet, and I want you to apply your tourniquet between your systolic and diastolic. If you apply your tourniquet above your systolic, you'll have a true tourniquet. You'll cut off blood flow to the fingertips and you will cut off blood flow back to the heart from your veins, right? So if this is your blood pressure cuff, get your blood pressure and then pump it back up again to above your diastolic before you start your IV. That will make your vein bigger and dilate, and because it's bigger, it'll also be stiffer. So you'll have a bigger target, which is stiffer and easier to puncture with your vein. If you're above your systolic, then you're going to cut off all that blood flow. And if you're below your diastolic, you have an ineffective tourniquet. So you might as well not use a tourniquet. So again, you'll want to consider, obviously, if your patient's a 98-year-old little old lady who is also 98 pounds, then this tourniquet might not need to be as high because her systolic might be at 90, and so you might not want to put a very tight tourniquet on. Or if you have your patient's under CPR, normal tension on a tourniquet might be too high and you'll still have a harder time puncturing that vein because your tourniquet's on too tight. So just make sure to gauge your tourniquet somewhere between your systolic and diastolic to let it help you do what you're about to do. Okay, second thing is the beveled edge of the needle. So this is my needle. Come on, that's my artwork. So you'll have to bear with me, stick with me here. It's a Hexon PVC. There's my beveled edge. Some of you old schoolers like myself, we used to use these instead of suture removal kits, the fancy ones now. We used to use these to cut the sutures, right? Because that's a cutting edge, that's a beveled edge. If you go in sideways with your bevel sideways to the vein, not the skin, the vein, then you'll lacerate the vein, and that's where you get your infiltration. You want to puncture it, all right? So a lot of times, especially if you have IV drug abusers, heavy IV drug abusers, someone who's getting chronic chemotherapy or labs drawn, then they might have scar tissue on the top. So you might want to do a sideways approach on that same vein. And what you'll do is you'll puncture with the bevel up through the skin. If the vein is behind the needle, then you'll want to turn your bevel sideways and then go in sideways through the vein with a turned bevel. So even though the bevel's not up relative to the angle of the vein you're going into, then your bevel's still puncturing into the blood vessel, right? So bevel up in this case goes right through the skin, goes into the vein, and as you can see, doesn't lacerate while going into the vein. So you don't have a lot of infiltration. Okay, so sometimes you'll have patients who have lots of valves, or they're very tortuous veins, very squiggly veins. Can't help that. That's a little bit of a lotto. You might want to use a smaller gauge catheter or a smaller gauge needle, and we'll go over that real quick. So if I have an 18 gauge vein, this is an 18 gauge vein, and I put in an 18 gauge catheter. So this is an 18 gauge catheter in an 18 gauge vein. Even if I put in on a tourniquet, right, I don't have any blood flow coming in. I don't have any blood flow going around. And so a lot of times what I hear from my colleagues, some nursing friends and some physician friends, is I can't get any labs from this guy. I can't understand it. He's got an 18 gauge catheter in, IV catheter in, and they can't get any blood back. This is great for resuscitation. So if you're giving lots of fluids and lots of blood or several meds and you're trying to give it quickly, then without the tourniquet, of course, you can give a lot through a large bore. So patients coming into the ER that we're trying to fluid resuscitate because of blood pressure, patients that are in the ER for blood pressure issues, patients who are, or blood loss issues, patients who are going into the OR, or anesthesia, will oftentimes use a large bore IV because we're more interested in resuscitating them. But patients who need labs that you're trying to get blood work from, then you might benefit from a smaller gauge catheter. So this now is a 20 or a 22, and you can go too small, so let me go over that later. But a 20 or 22, now you have blood coming back. Oftentimes, even without a tourniquet, you'll have blood because there's room in between the blood vessel. This is an 18 gauge blood vessel. You got a 20 gauge needle. You're getting labs back. So this is great for labs. And that's great for resuscitation, right? So oftentimes in the pre-hospital world, we want that. But sometimes in the in-hospital world, we want this, a smaller gauge needle. So let's talk about a little bit about hemolysis, because we get a lot of that in the ER and in the ICU. This is your blood cell. This is a red blood cell. If you try to suck that blood cell through here with too much pressure, that thing gets bigger and expands as it's going through this needle. It gets bigger and it lyses. So that's where you get the callback from blood bank saying it's hemolyzed. So that you cause hemolysis by sucking too hard or using a small syringe. So a small syringe is high pressure. A large syringe is high volume. So a 60 cc syringe, the reason why it's hard to give like dextrose or sodium bicarb through the big ampujects is that you're trying to insert a large volume through a small gauge needle, usually a 20 gauge in your. So if you're trying to just give adenosine or adrenaline or atropine, then you're only giving a few cc's through that, and you've got a smaller syringe, and so you can apply that much pressure through that syringe and get that adenosine downstream fairly quickly. So anyway, so that's the size of your catheter, your needle, and also the size of your syringe that you need to consider in that avenue. All right, so last thing, going back to my needle again, this is my catheter. All right, and I am going to puncture the skin, and then I'm going to decrease the angle so that my catheter can go into the vessel. So now my catheter is in the vessel. I got the flash as soon as I punctured the skin. It went into the vein, right? I got the flash, threaded my catheter, took out my syringe, and what happens, right? If you leave it like that, you have a tourniquet on, and so because you had this tourniquet on and you leave it like that, you're just gonna get a bunch of blood back, right? You got a flash, and now you're just getting a ton of blood back. If you apply pressure too distal to the tip of your needle, and all you're doing is helping your catheter, all you're doing is helping your tourniquet. So if I apply pressure over here, this is the tip of my catheter, I'm just helping my tourniquet, and more blood will come back out through here, and you've made a whole big mess inside the medic. All right, so now what I want to do is, I overshot it and I'm applying pressure here. So now I'm trying to apply so much pressure that I'm going to occlude the catheter and the blood vessel. So that can be done, but you're going to have to apply a lot of pressure to occlude the catheter and the blood vessel. And that's also why you get a lot of bleeding if it's directly in the crook of someone's arm, right? You'll get a lot of bleeding. It's hard to apply that much pressure if the catheter tip is at the crook of someone's arm. But if you apply just a little bit of pressure at the tip of the catheter, then you'll occlude not only the tip of the catheter, but the blood vessel that's around it, and you won't get anything on the other end. And so that's why some people make a big mess when they're starting IVs, especially when you start off, until you can figure out where that end of that catheter is. Okay, so a couple of things that you want to consider: someone with chemotherapy, someone with prednisone therapy, someone who has lots of chronic medications will have will decrease your chances of getting a good IV. Veins that are tortuous are difficult. You might want to use a smaller gauge IV, and valves. So valves is kind of like winning the lotto. All right. Well, anyway, this is your IVs. Things to know about your IVs. I'm Jay. Like, share, subscribe, and looks like hoping to make you guys better medics, faster medics. All right, cheers.